Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome back to DocTalk. I am Brent Leavitt, owner and proprietor of Battleborn Financial Advisor and Health Insurance Brokerage here in Pahrump, Nevada, and also now in North Las Vegas and Las Vegas. We're pleased and welcome to talk about primary care and physicians in the Southern Nevada area, specifically in Pahrump and a little bit in Las Vegas. Today we are joined by Sheri Cipollini. She is our wonderful nurse practitioner, and she came over from Reflections Healthcare, and now she's starting her brand new own practice called Aesthetic Enhancements. She's wonderful to have you here. Our last couple segments, we've been doing a lot of nurse practitioners, and I think it's because I love nurse practitioners. You guys are on the board. You're sitting there with the patients, and you're kind of in front of them. You know and treat them a little differently. And you've been practicing in this town for quite a long time. I think you're probably one of the #1 recommended person to see in town when it comes to primary care. Everybody's always like, oh, see Sheri. Sheri's wonderful, things like that. Because I think you do so many things, anywhere from women's health to family, a little bit of family stuff, all the way up to and your new venture with this aesthetic stuff. I really want to go into that a lot about how you deal with aesthetics, what it is, and things like that. And with that being said, I'm going to just kind of put a little plug in there too. Make sure you guys, if any questions you have throughout the show, episode, you want to make an appointment, please give us a call. We do health insurance stuff, especially open enrollment coming up right now pretty soon. Battlebornins.com gets you directly to our calendar. You can make appointments with us to talk about your insurance needs. And then also, you have a website too. What's your website again too? It's aestheticenhancements.online. .online. So make sure you put online. Yeah. You can make appointments online to book your skin. It's skincare needs and things like that.
So skincare, aesthetics, fillers, Botox, hormone optimization, consultation. You can schedule a consultation on there as well.
Yeah, it's phenomenal. And a lot of stuff she does, unfortunately, doesn't fall under the insurance umbrella, especially when you're dealing with taking care of your aesthetic needs, things like that. But it's a great program. She does do some insurance-related things that kind of tie into there. So it's a great way to get everything done and things like that. So tell us a little bit, Sheri, how long you've been in town, kind of your practice, what your mindset is, what you're doing, and tell us a little bit about you.
Okay, so I have been in Pahrump for about 26 years. I have been in the nursing field for, oh my goodness, 15 years. So my background is ER nursing, and that's primarily what I did up until I became a nurse practitioner. I've been a nurse practitioner for 4 years now. And Dr. Craig and I opened the primary care practice, Reflections Healthcare, 3 years ago. And then I recently opened up Aesthetic Enhancements because I wanted to branch out and kind of change my focus a little bit to aesthetics while continuing to do the primary care and focus more on women's health, hormone optimization, the wellness side of medical, and just be able to offer all the services.
Yeah. So women's health is the biggest thing I think that's everybody knows you for.
Right.
So you mentioned hormone replacement. What's that entail, and why would somebody want to?
So as women and men age, our hormone levels start to decrease. Women, especially with menopause, so we start having hot flashes and vaginal dryness and irritability, difficulty sleeping, night sweats, all of that. And people can also have psychosomatic symptoms like depression and joint pain, and the hormone optimization helps improve some of that. So I do different things. You can do prescription medication for hormone optimization. I do pellets, which is a bioidentical pellet that gets inserted into the fatty tissue, and it lasts 3 to 4 months for women and 6 months for men, so they're not having to take a medication every day or remembering to put on cream every day. And then, of course, there's the cream option as well, and men can do testosterone injections. So I do all of it. I do lab work, kind of determine where levels are, discuss symptoms and other concerns, and put together a plan that's specific to the patient.
I mean, I think that sets you apart from anywhere else in town, is that especially focus on health, dealing with your hormones, stuff like that. I think we every time in the episode we talk about why do we need to see the primary care doctor or see your physician, things like that. And this is a big deal, especially as you get older and things like that. And I mean, you ran, especially women, any ages too. It's dealing with getting your wellness stuff done.
Right.
We want to focus on getting to see a wellness exam. I think that's where you're really powerful, is getting that done. Maybe you need to get those hormone replacements done, things like that. You can call and go online to her website. We'll put up on the screen there. Go to aestheticenhancements.online,
yes.
not .com, things like that. I think you can find you on Facebook, things like that as well. And you'll see that all the great reviews, and you can schedule those visits. Again, a lot of it's done on her insurance. Now, she's wonderful, and she's been able to contract a lot of them, carry over. A lot of current patients she's seeing on the medical side. We're focusing more at this aesthetic enhancements, dealing with a lot of the aesthetic things. We'll talk more about that as well. But I want to make sure you know that she is still taking some of those older patients you've seen, things like that, come over on your own. A lot of United Healthcare, PPO stuff. I believe you're still in the Humana PPO. We'll verify that later. And then also dealing with people that are on original Medicare. They also you also have a grant with the NIE Coalition.
Correct.
As well.
We have a women's health grant right now that the NIE Communities Coalition put together. So I'm able to provide women's health services to uninsured women, and it'll cover the expense of pap smears, birth control. If we find any issues, so ovarian cysts or cervical cancer, something that needs to be addressed, we can refer to a specialty provider to take that over for us.
Yeah, definitely. And so make sure you take advantage of that too. That's a wonderful program. We have such great resources here in town. In fact, you even help with the RAM, the Remote Area Medical, which is coming in October. I think we said October 4th. And
4th and 5th, the first weekend of October, Saturday and Sunday.
Yeah.
People will be asked to make an appointment this year because of COVID. We have to limit how many patients come in at a time, but we offer dental services, vision services, and medical services, including women's health exams. The number, I can't release it yet, but if you guys are interested, just follow on Facebook. The coalition will be releasing information on that, and we'll also get advertising out in the community so people can make those appointments.
Definitely.
And we also are able to do referrals for mammograms. So patients that are, we don't ask questions. If you're uninsured or insured, either way, we can provide the services. Yeah.
And the biggest thing, especially if you're uninsured right now, we have a lot of people in this town that just go without insurance. Maybe you think that insurance is too expensive or you don't quite understand it. I want to make sure you know too that our office is a resource. Battleborn Financial. We're over off of Commercial Drive. In fact, we're right across the street from our old office in the big red building right in between the Intermountain Healthcare, Urgent Care, and also Goodwill. And you can work with us and go online, make an appointment, and you'll find that a lot of people, it's a lot more affordable than people think. A lot of people freak out. They're like, I got to pay so much for insurance, but I got this huge deductible, and they freak out and think that, oh, I'm going to pay all this money. Why am I getting insurance? And it's really not about that. It's about getting the coverage so in case something catastrophic happens. You mentioned these pre-screening stuff where it's covered 99% of the time, it's covered at no cost to you. The insurance company pays the doctor or physician and everybody else to take care of those things. And you get that taken care of. And then if you find something catastrophic happening like cancer or cysts and things like that, that's where it can get really expensive. And I can't tell you people call me after they get diagnosed with these things saying, I didn't get insurance all the year long because I thought, oh, it's too expensive or what isn't. Now they're finding out that I wish I had insurance because it's a whole lot cheaper than dealing with what I'm going with. And it's frustrating because if you wait till the last minute to get them done, it's 10 times the worst time to do it because then you got to put off treatment and you need to get treatment right away to get it taken care of. The worst thing to do is put off treatment. Open enrollment every year is November 1st through December 15th. If you miss that deadline this year, in fact, if you're under 65, they've extended it all the way to January 15th this year. So you have a little extra time. But the deadline to get coverage for January 1st is still December 15th. So those are important to know. And the cool thing is we have some new plans coming out next year. Can't give too many details yet, but a lot of them are going to have a lot of zero copays to see your primary care doctor and getting to see those visits. They really want to push you seeing your physician.
That's nice.
And a lot of the plans, if you're on Medicare, a lot of those plans actually cover you at no cost to get those physicals. And Sheri, remember, she helps deal with those doctors, things like that. She's still taking like the P3 plans and things like that as well, where you get a lot of zero copays. Even a lot of PPO plans that she takes, fee-for-service stuff, you have copays and stuff, but all those wellness services, in which we really want you to get to see, you get a lot of those at no cost to you. And the second segment, I want to kind of go, and we have about 3 minutes left on this one, we want to talk a little bit more about a lot of the cash pay programs we do at Aesthetic Enhancements and how those really help you out. I know I've been thinking about, man, I need to see her too for all this other stuff I got to get done too. I know it's just women. It's not just women that deal with those things. It's men as well.
Right.
And your practice is going to be servicing a lot more than just those patients. You're going to have a couple other people in that office too, besides you.
Yes.
So you're going to have, what are you going to have there besides you?
I have Jamie Schneider, who's a massage therapist, and Kat McCarter, who's an esthetician. So she does facials and waxing and lashes, and she does some radio frequency stuff and LED light stuff. So we can cover quite a few things. And then we're adding Susie Wolfenstein. She's doing apprenticeship right now for permanent makeup, so microblading for eyebrows and permanent eyeliner and lip blushing. She'll join us October 1st.
Yeah, and my wife actually just got some lipstick done, and it's actually been great. She's enjoyed it a lot.
Yeah.
So those are things that we're going to be really awesome there at the facility. So just a reminder where she's at. So if you guys have seen the billboards, things like that around town, her office, Aesthetic Enhancements, is going to be off of 372, right there near the little roundabout there. It's over by the Dollar Tree. Everybody loves Dollar Tree because it's only $1 for things, you know. Right next door to that, wonderful facility right there, right next to the Farinata pizza place even.
Yes,
it's a lot of pizza, get your doctor go. A lot of people are freaking out about that. Are you doing any like online visits as well and consultations as well too?
Absolutely.
So especially during COVID, people are like, well, I don't want to see the doctor and things like that. You can get a lot of that stuff done virtually too, and seeing. I know we have a lot of people that are established patients of yours. Like, oh, she's leaving reflections. Where do I see her? She'll still be seeing you. I think you mentioned segmenting a lot of that patient load, things like that, making sure they're getting seen when you need to, as well as working on the aesthetic stuff. All around wellness in this facility as well here in town. The wonderful thing about Pahrump, we're very blessed to have you here and working with us in Pahrump and making sure that we're taken care of. I just want to make sure that we're here, we understand what we're doing. I want to talk a little bit more. We're going to, so the wellness stuff versus women's pap smears. You do the pap smears, mammograms.
I order mammograms. So I
yeah.
do breast exams and the pap smears, and then I refer for the mammograms.
Yeah. Do they do those here in town as well, or do they have to go to Vegas for a lot of that stuff?
Desert View Hospital does mammograms, and I think they do a fantastic job. A lot of people may not realize that Desert Radiology is who actually reads Desert View Hospital's mammograms. So if you go to Desert Radiology in Vegas, it's the same people reading your mammogram.
Okay. So cool thing is you have to go very far for it.
Right, yeah.
And if you did, a lot of your plans actually provide free trips to your doctors and stuff too.
Right.
Especially around the HMOs, things like that. Well, you call my office and talk about those, you know. So we're going to go to break in a second here. We're going to come back. We're going to talk more about the aesthetic services, how they affect you, getting those things done. And I really appreciate you coming up, and we're going to talk in. We'll see you guys in the next few minutes.
Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome back to DocTalk. I'm Brent Leavitt here, owner and proprietor of Battleborn Financial Advisor. Again, we are joined by Sheri Cipollini, our wonderful nurse practitioner, women's health specialist, and aesthetic enhancement owner. She's here today with us talking about her new practice. I just opened up here. She's working with insurances and helping us get our women's health care, things like that need. Working with a lot of the different programs here in town, Medicare Advantage, anything for under 65. Remember to call our office, deal with that. For today, this segment, I want to focus a lot about her cash pay program that she's working on, working with regards to seeing patients with your skincare needs, hormone replacement, sexual wellness. I know a lot of people love to talk about that. Who doesn't like to talk about sex? But things like that, we'll talk about that. We'll go in a little more about that. But let's talk a little about, Sheri, let's talk about the aesthetic portion, how that works with you. Why do I want to see you for that kind of stuff? How do I make my skin better? Things like that. Give me a little bit about that.
So with skincare, you want to start with your basic skincare, making sure that you're cleansing your skin and making sure that you're applying products to address the oxidative stress and the damage from exposure to the environment and sun over time. So I have medical grade skincare products. I carry the line ZO Skin Health. Also, I do Botox, which relaxes and softens the wrinkles, and filler to replace lost collagen. Over time, we experience bone loss, collagen loss, and our fat pads start to shift and kind of slide, so we get like the hollows under our eyes, we get little lines in our cheeks. So I can help address some of that. I have products that stimulate collagen. I have a laser machine that can pull up sun damage and help get rid of the brown spots, melasma that occurs over time. laser resurfacing, so doing laser peels to basically take off the dead layers of the skin and regenerate some of that tissue. I have a hair removal machine, so I can do hair removal on every part of the body, and it's a great machine. It's not very painful, and it moves pretty fast, so you're not being tortured per se, as people that have had hair removal 10 years ago are probably like, oh my God, no, I would never do it again, but it's a lot different now.
Is it one treatment or is it
Multiple treatments, generally 5 to 6 treatments, and I have a package, so depending on the size of the area, I have different pricing packages to address that. I do PRP, platelet-rich plasma, where I draw your blood, spin it, take the platelet-rich plasma, and I can re-inject it into the face, or there's sexual wellness injections where it can be injected into the penis for a man to help with erectile dysfunction or Peyronie's disease, and then for women to help with urinary incontinence and sensation, basically.
What's Peyronie's disease? You mentioned that.
So it's a curvature of the penis. Like the fibrous tissue can build up and cause that curvature, and it's painful. So it helps address that. You can also use PRP for joint injections. So I do joint injections, large joints primarily, so like knees and shoulders. I've done an ankle injection on a patient, and she found it to be helpful. But unfortunately, those things are not covered by insurance because they're more alternative alternative medicine.
How do we know, like, when you go in to see you, like, how do I know, like, hey, I need to get this done, Like, how do you, like, really solidify that? Is that something you do, help them with that, or?
Yeah, so I'll do an assessment, and I'll ask, what are your concerns, what bothers you the most, and then I can tell them what I see and what my recommendations are. Another thing I do is PDO threads, which can actually basically give a mini facelift and help tighten tissue, and it also stimulates collagen. I have microneedling, which helps. You can treat acne scars with it, also stimulates collagen. So I have a few different devices that I can use, and depending on what their concerns are, I just kind of customize it to the patient.
Yeah. So a lot of those scars from childhood, things like that, teenagers. Do you work with teenagers as well, like with their acne and things like that?
I do, I do.
Yeah,
I've done some laser peels on teens to help with their acne, and then also recommend skincare, kind of get them on a skincare plan to address it.
So a lot of our facial stuff, your hair removal, things that we just need to make sure we're, it's like, hey, I want to look better, feel better about myself.
Exactly.
And you mentioned too earlier about like even the hormone stuff, like you mentioned just getting yourself, as you go through phases in life, as you change you get some depression with that, things like that, and making yourself feel better, you'll hopefully,
from the inside out.
Inside out, it's all about just making sure you're healed all the way out on the outside.
Right.
You mentioned it's alternative. What do people end up getting as the medical treatment typically that you need as an alternative?
So with the skincare stuff, I wouldn't say that there's really much medical-wise that you can get. I mean, dermatologists do address skincare from a medical perspective, and they can do chemical peels, and they'll prescribe retin products like that to help with the skin. But Botox and filler, Botox can be used medically for like headaches and muscle spasms and cerebral palsy. There's some things that they use it medically for, but I don't do that work. Hormones can be covered under insurance if you're doing the prescription medications like the oral estradiol and oral progesterone, and testosterone injections can sometimes be covered under insurance. I personally prefer the bioidenticals, so if people are able to afford that, that's the direction I prefer to go, but I will work with what the needs of the patient are.
Yeah. I know on the insurance side, a lot of those are like the testosterone cypionates and like the estradiol, things like that are actually usually relatively inexpensive if they're worried about cost and things like that, and they can be covered. It's more important. I know you want to get the biosimilar, especially a little more expensive. Insurance doesn't cover them a lot of times, but they do have those options. It's good that you can both of those and things like that. And you'll find that a lot of those generics, things like that, are covered under your insurance a lot of times at very little cost too, very low copays and stuff. So it's very important that you can work with those. Again, you can call our office, talk about your insurance needs, see Sheri, especially if you need to get that done, taken care of. Now we talked about skincare needs, especially if you're thinking about, hey, I'm not looking great. So on that side of things, you mentioned, I know we see your billboard all the time, and you have like 1 billion things listed there. So we talked about skincare needs, hormone replacement. We did hormone replacement. So what kind of stuff? You mentioned like you also do like sexual wellness, things like that. How does that tie into things all in the same stuff we were talking about, or is there some other additional things in there
So
as well?
a lot of it ties in together. So you optimize your hormones, and that's going to help with your sexual wellness. The testosterone can help with libido, erectile dysfunction, mood. Because if we're not in the mood, we're depressed. We tend to not feel very sexual. If we don't feel good about the way we look, we tend not to be as sexual. Menopausal women can sometimes struggle with the vaginal dryness, so the hormone optimization can help with that. There's, and like I said, the O shot, which is the PRP female shot, can help with some of the vaginal concerns, and then the P shot, which is the Priapus shot for men, can help with the erectile dysfunction, as I mentioned. So you can kind of look at it all together. I like to start with labs when people have that complaint to kind of see, is there something deficient, and start addressing that. And then also we really have to look at the mind, because the mind affects everything and how we feel. So it's a whole bag of stuff that we need to address.
Yeah, so there's a lot of just baseline we need to get with you. And do a lot of insurances cover that baseline stuff, or does that have to go through your
Generally,
cash-based
insurance will cover the labs. If you have symptoms and medical concerns, the insurance will cover. It's just you look at the coding, you order the right codes appropriately, and generally insurance will cover it.
Yeah, so make sure you go online, aestheticenhancements.com.
Online.
Sorry,
Yeah, I know. I'm sorry. I'm so difficult.
We're going to fix that. So make sure you go .online.
Yeah.
Look her up, and that's probably good that you do that, because you got to be different, anyways.
Right.
And look her up. And most people don't even think you actually put websites in, anyways. They just type it in.
Hopefully, it'll pop up. Yeah.
Yeah. Anyways, and just help it up on Google and everything. Look her on Facebook too. I think give the office a call. The phone number's below. Make sure you call the office if you want to make an appointment with her. Her office staff, front office staff, is wonderful too. They help take care of you. They know the plans and what she takes, things like that. In fact, I think I remember a couple of years when I first met Sheri, it was more of a, hey, I'm a broker here in town, come to see you. I'm just, dude, the office staff was like, hey, there's some cool new plans coming in. The office staff was wonderful, welcome me in and say, hey, let's work with you. And they want to get contracts because they want to make sure you see you on the wellness side, get you in, get that wellness exam taken care of, get that baseline, find out which labs in order, things like that. And they pretty much tell almost like everything, with the exception maybe just a few different plans. But for the most part, they'll work with you. And if you need to switch your plan to be able to see Sheri, you just give us a call, 764-2252, and say, hey, I really want to see Sheri. I want to get to that wellness exam so I can find out about my getting to do those cash pay things. I want to get my sexual wellness taken care of. I want to make my face look better. In fact, I'll probably call afterwards and get my stuff taken care of. I'm like, man, I got these bags in my eyes. Take care of those, help see you, and take care of my own skincare. Tell you what, kids, they do a number on me. As everybody knows, I got 6 kids, and trust me, they age you a lot quicker, really what you need to. And see the office and take care of your needs. And then if you need some cash pay stuff, make sure it's like, hey, I really want to take care of this, budget for it, and make sure you're financially there. If you need some financial planning about it, hey, I need to figure out how to pay for it, just give me a call. Talk to us online. As you know, I'm a certified financial planner. We can help work with you on that. Go on our website. You can book us online. Make sure you can go and see those and get those treatments on. I love to see people dealing with their whole bodies, mind, body, mind, finances. Everything just ties together. We want to live happy, productive lives. And we live in this town, especially during COVID, it's, depression, things like that. We're just feeling like down on ourselves and maybe not taking care of, eating a lot more junk. Maybe realizing, I want to feel better about myself, despite all the fact that I can't do the things I was doing before. We're kind of reinventing ourselves a little bit. Maybe we're not going out and spending money on things we used to. Maybe we can divert that cash to some things to maybe improving ourselves. Invest in just you. You deserve it. You deserve to go out there and make yourself better. Go out and talk to aesthetic enhancements. I keep saying that.
No, that's okay. It's going to be a hard transition.
We're going to edit that a little bit. And just so you know, too, we're going to make sure you note that if you are a patient of Reflections, Dr. Craig is not going anywhere either.
Correct.
He is still in town.
Yes.
He is a wonderful physician. Sheri has an opportunity to make herself even bigger and better. And we love that here in town. We want to grow. We love growing businesses. We love the fact that, Pahrump is a growing town. As much as we want to admit it, we love our small town. We love this little town, but it's a growing place. And we're going to see Sheri, a lot bigger in the future here. We're going to be like having all these different people, and she's going to be this great operation. And when you outgrow your space, you got to just continue to grow and do it. we've supported her in her business in Dr. Craig's office, and now Dr. Craig can expand even more too, and now Sheri's expanding more too. So it's a wonderful thing we have to have you here and work with us. Again, if you have any questions, go online, call the phone number. Give your phone number again for us.
It's 775-877-9500. And I just want to add, Dr. Craig and I will continue to work together and collaborate, just so I want people to know that even though we're separating, we still have a great working relationship and plan to continue that.
Exactly, yeah, just because their businesses are growing. It's just a wonderful thing, and if we can support that growth, I mean, we continue to go forward.
Exactly.
And everybody wins in this town. That's what I love about this. We're all in this together in many ways, and just making sure supporting small business, supporting each other, and taking care of your health. We'll see you guys next week. We'll talk to you again, and thank you so much for joining us today. We'll see you again.